If you take something for allergies, or trouble sleeping, or anxiety, or even bladder control, there's a chance those medications could be affecting your brain in ways most people never realize. Some researchers now believe certain common medications may be linked to memory decline, brain shrinkage, and a higher risk of dementia, especially when they're used regularly for long periods of time. And the disturbing part is, these are not rare medications. They're everyday drugs millions of people take without a second thought. Some are prescription medications, others are sitting on store shelves right now. So why are scientists becoming increasingly concerned about them? And how could something designed to help your body potentially interfere with your brain? If you enjoy videos exposing hidden health risks and breaking down the science behind them, subscribe and turn on notifications, because what researchers discovered about these medications became even more concerning. The answer starts with one tiny chemical your brain depends on every single second. It's called acetylcholine, and without it, your brain struggles to communicate with itself. Acetylcholine acts like a messenger between brain cells. It helps you focus, learn, react, form memories. Even simple moments, remembering a name, following a conversation, staying mentally sharp, depend heavily on this system working properly. Think of it like the electrical wiring inside the brain. Every thought, every memory, every decision travels through signals constantly moving between neurons. Now imagine weakening those signals little by little, day after day, year after year. Not enough to notice immediately, but enough that over time, the brain's communication system slowly becomes less efficient. That's what researchers worry may happen with a group of medications called anticholinergics. Anticholinergic drugs block the activity of acetylcholine. Sometimes that's useful. That blocking effect can reduce allergy symptoms, calm bladder spasms, reduce nausea and motion sickness, and even make people sleepy. But while those effects may help certain symptoms, the brain itself may also be paying a price. Because acetylcholine plays a critical role in memory and cognition, and when those signals are repeatedly blocked for months or years, scientists worry the brain may slowly begin adapting in harmful ways. What makes this especially concerning is how common these medications are. Some older allergy medications, like Benadryl, have strong anticholinergic effects. Many over-the-counter sleep aids contain similar ingredients. Certain bladder control medications, motion sickness drugs, digestive medications, and some antidepressants may also contribute to what researchers call anticholinergic burden. And many people have absolutely no idea. Someone might take an allergy pill during the day, a sleep aid at night, and another medication later on, never realizing all of them may be affecting the same brain chemical at the same time. Each medication may only contribute a small effect on its own, but together, the burden on the brain may become much larger, and researchers have been studying this concern for years. Several major studies have found links between long-term anticholinergic use and increased dementia risk. One large review involving more than 1 million participants found that heavier exposure to these medications was associated with higher rates of cognitive decline and Alzheimer's disease. Other analyses have found that prolonged use may significantly increase dementia risk compared to non-users, and brain imaging studies have raised even more concern. Some researchers observed reduced brain metabolism, smaller brain volume, and greater brain atrophy in people regularly using strong anticholinergic medications. In other words, this may not just be about temporary drowsiness or brain fog. There may be physical changes happening inside the brain itself. And the frightening part is, those changes may develop slowly and silently for years before symptoms become obvious. That's what makes dementia so unsettling in the first place. the brain often changes long before memory problems become noticeable. At first, the signs can seem harmless. You walk into the kitchen and suddenly forget why you went there. You lose your train of thought mid-conversation. You reread the same sentence 3 times. You misplace your phone more often. Names become harder to recall. Your thinking feels slower than it used to. Most people brush these moments off as stress, lack of sleep, or simply getting older. But researchers worry that in some cases, they may reflect deeper changes happening quietly inside the brain. To understand why this matters so much, you have to look at the parts of the brain most affected. One of them is the hippocampus. The hippocampus plays a major role in learning and memory formation. It helps convert experiences into long-term memories. Another critical region is the cerebral cortex, which is involved in thinking, attention, language, and decision-making. These are some of the brain's most important communication centers, and acetylcholine helps keep those systems functioning properly. So when that communication becomes repeatedly disrupted over long periods of time, memory and cognition may slowly begin to suffer. And older adults may be especially vulnerable because aging already naturally reduces acetylcholine activity. That means the brain may have less reserve to compensate when medications block those signals even further, which may help explain why some studies find stronger cognitive effects in older populations. Now, it's important to keep this balanced. This does not mean these medications should never be used. In many situations, they can be extremely important and medically necessary. Sometimes they are the best option available, and short-term use is very different from taking them continuously for years. For example, taking an antihistamine temporarily during a severe allergic reaction is very different from relying on strong anticholinergic medications every single day long-term. The concern is mainly about chronic exposure, especially when multiple anticholinergic medications are combined together. And this is exactly why awareness matters, because many people simply never realize these drugs can affect the brain at all. They assume that if something is sold over the counter, it must be harmless long term. But the brain is incredibly sensitive. Small chemical changes repeated daily can eventually create much larger effects over time. The good news is there may be alternatives depending on the condition being treated. For allergies, some newer antihistamines may have less penetration into the brain. For sleep problems, some people discuss alternatives with their doctor, such as better sleep hygiene, melatonin, magnesium, or medications with lower cognitive risk. For bladder symptoms, newer medications may work differently and reduce anticholinergic burden. And for digestive issues like IBS, dietary strategies or alternative treatments may sometimes help, depending on the underlying cause. But the most important step is not self-diagnosing, and it's definitely not stopping medications suddenly on your own. Instead, review your medications with a doctor or pharmacist. Ask whether any carry strong anticholinergic effects. Ask whether safer alternatives may exist. Especially if you are over 60, take multiple medications, or have already started noticing memory changes. Because protecting brain health is often less about one dramatic event and more about the small, repeated exposures that slowly shape the brain over time. Your brain is adapting every single day to your sleep, your stress, your food, your movement, and even the medications you take regularly. And sometimes the most dangerous risks are the ones people never think to question, because memory loss rarely begins all at once. Sometimes it begins quietly, with habits repeated every single day.